Okay, hi guys, welcome back to NP Now's YouTube channel for another Sunday fun day. I'm Sakira, I'm a family nurse practitioner, and I'm coming on today to talk to you guys about finding a job if you're having trouble finding a position. So I was online today doing some research, and I kept seeing a lot of new grads saying how they cannot find a job. They're in an oversaturated area. They've been graduated a year and a half, 2 years, and still nothing. So I wanted to come on and try to give you a few tips to see if this will help you a little bit. And then you can always email me or leave a message, and I'll get back to you if you have any specific questions that I can answer. So just a little bit of recap. I'm a family nurse practitioner. I've been practicing for about 5 years now. I've done primary care, urgent care, occupational health. I also co-own a med spa. I'm doing this business right here, which is NP Now, which was originally I consulted big companies. Now I'm just doing it for nurse practitioners. And then I had experience with urgent care. That's my favorite. And that's what I currently do as well as I work in surgery. All right. So I remember when I first graduated, my first job was not that hard to find. And it seems like it's getting harder and harder for everyone. But I do want you to know and rest assured that, don't give up and keep looking. I don't care if you live in a saturated area, if there is 10 NPs applying to the same job or 1,000 NPs applying to the same job. Keep on going because the jobs are out there and you're going to get a job. It may not be initially what exactly that you want. So I'll go over like that later because you need to keep an open mind, but the jobs are out there and you will get a job. I don't care if somebody says, well, there's 1,000 NPs applying for this one job. Well, you keep applying. I can't tell you how many times I see, look at businesses, for instance. How many times do you see a Wawa across the street from Quick Check? Do you think Wawa is worried about Quick Check? I mean, there's a reason for the madness behind that if you look up the science behind it. But just worry about yourself, stay in your own lane and keep pushing forward and don't worry about anyone else because you will get a job. So one of the things to keep in mind when you're looking for a job, though, is that if you're going to get a job, such as like a health risk assessment job, like a 1099 job, don't really want that to be your main job, but if that's the only thing you can get right now at the time, that's okay. Because you're getting some type of income coming in, especially if you need to get that income coming in, but it's not something you're going to want to stay in for too long because you need to be having, if you plan to renew your certification through CEUs and clinical practice, you're going to have those clinical hours of prescribing, diagnosing, and treating. And in that position, you're really not doing all those things. So that wouldn't qualify towards your 2,000 or however many hours you need for your certification, whether you're AANP or ANCC. So make sure one of the tips I wanted to tell you is to make sure like you're applying to as many positions as you possibly can, even if you think that you really don't want that type of position. I know a lot of people, when they get out of school, they're very strict. I need to get this job in this office as soon as I graduate or nothing else. Well, you're going to have to try to be a little flexible, especially if you're a new graduate. Because you may find that that's something that you will end up loving, or that job might lead you to another job, which you might grow to love, or another opportunity that will put you in a better position than you were before previously. So, of course, the most common places to look for a job: Indeed, ZipRecruiter, Monster. I don't know. I have heard of some people looking on Craigslist, but there are jobs on Craigslist. So I know the most common for me is Indeed. I'm on there, especially when I get someone who is saying how there's no jobs and they're like worried about jobs or looking for jobs. I usually go on Indeed first. If I don't know a specific recruiter, if someone hasn't contacted me saying, hey, do you know anyone? Are you interested in an opportunity, or do you know anyone interested? So, which is usually the recruiting agencies. So your most common websites are going to be ZipRecruiter, Indeed, Craigslist, Monster, the hospital websites. Those websites like that are, go to careers at whichever.com. But I'm going to tell you the best, and how I found my first, the best way is word of mouth. You will be surprised at how many jobs people find just talking to people in everyday conversation. Somebody knows somebody that knows somebody who's looking for somebody, and just set the intention and let it be known that you're looking in your everyday, as in your RN job currently. There may be an opportunity there, but you just don't see it because that's not really where you want to stay. Maybe you want to leave. I'm not sure what the situation is, but the opportunities are there. So one of the things you can do is maybe spoof up your resume. I know that I did a video previously about this, and I gave you some tips about spoofing up your resume and things like that you can go on and you can take a look at that if you would like to. Because the video goes over like different tips and things to do if you want to do that. Hold on one second, guys. I forgot my light here. Get some light on me. Okay, I look a little bit better, a little bit brighter for you guys. All right, so your resume, make sure your resume is on point. I do go over that a little bit in my online course that I have. And I do consult about resumes and things like that, just to give you a little bit of an idea of how I did my resume. I do give a copy of my resume that I use, as well as a sample copy of a resume with my online NP Now course that I have on my website, which you can go and purchase that right now. It's on sale at npnowllc.com. And you'll find my whole bio, all the services that I offer, consulting, speaking engagements, things like that. But I do have copies of resumes, sample resumes, and there's also resume writers. And like I said, go on my channel. I just did that video for that last week. Networking, I spoke a little bit about that. People that you already know. You also can look into your current job, and then groups, such as I can't tell you, there's a wealth of information online in these Facebook groups, in these nurse practitioner groups, in these groups that you just get to talking to people, and they have all these cool tips, how they found a job and where to find a job. There's always new places to get to apply for jobs. So speaking to people, your people are going to be your number one gateway to positions, because they can be like a first line referral and get you in the door like that. So make sure that you apply to multiple positions. Like I said, you want to keep an open mind, because you may not get exactly what you want as soon as you come out of school, but you want to get something that you like, even if you don't love it. So you want to be an open mind, keep an open mind. I know, if you're a family nurse practitioner, you come out of school saying, oh, I want to work in women's health. You don't find anything in women's health, but you want to do something but you find an urgent care job, and you can incorporate a little bit of women's health into urgent care jobs. I work in urgent care. I've done a few vaginal exams or vagina GYN type of things in the past. Even when I did primary care, I've done a few pap smears in the past as well. You can get what you want, but maybe in just small doses, and then it exposes you to other jobs, other positions, other areas of expertise that you may not even know that you liked. So like I was saying, be open-minded. There's recruiting agencies out there that you get a recruiter who's always emailing you, texting you, calling, asking if you're open for opportunities. I know I get several phone calls a week, whether it be email, texting, or a phone call. They are always looking for nurse practitioners, and they're also willing to hire new grads. So finding a recruiter is one of the things that you can also try as well. I know when you go into Indeed and you start applying for jobs, for some reason or somehow those recruiters get access to your email, and that's how they get your phone number. And that's just how I found out. They get your phone number and they can call you and find if you're interested in work, and they'll ask you and then you say yes or no. And that's a good way to get started with getting your first position if need be. I know a lot of them are like, oh, we'll train you. A lot of them will say, okay, it's a 6-month contract, but possibly to extend or possibly for full time. So that is a really good way to get into get a job, is through a recruiting agency. Then one thing that I've noticed, or a lot of people have been asking because of COVID, is about telehealth and being a new grad. There's a lot of people that are saying yes and a lot of people that are saying no, but let me just explain that you're held to the same standard of care as if you were in person seeing the patient inside of a room with hands-on and ears listening. So you want to be very careful if you find yourself in a position where all you have is a telehealth position available to you. It's really a personal choice whether you accept that position, but understand, again, you do have a license that you have to protect, and you are held to that standard of care as in person. So I know with COVID, it's opened up so many opportunities for everyone to basically work from home. And that's one of the things that really intrigues people, and they keep looking for something that's convenient for them. So, how I feel with people doing telehealth as a brand new graduate, you got to really know your skills. You got to really know what your limits are. What was your experience as in school? Like, did you have really good preceptorship? Do you feel like you're able to fly on your own? Whether you're in a full practice state or a restricted state, it doesn't matter. You still need to make sure that you're competent. You're going to give the best care as possible, because these patients depend on you and they depend on that. So that's just something to consider. But I do understand that a lot of people can't go without a job or a paycheck. So maybe you might want to think about just keeping your full-time job as an RN and then working part-time or on the side or as a 1099, which I go over what a 1099 position is, doing health risk assessments for a company like Matrix or something. But you really want to think about what is very important to you when you're looking for a job, and just don't give up. Lastly, don't give up. You will find a position. Just be creative. If you live in a full practice authority state, you may decide that you want to open up your own practice and fly solo from day one, and that is perfectly okay. You can do that as well. You can self-educate yourself, take courses, do things online, read books, get the experience from day one like that, get a mentor. I do offer mentoring, and my mentoring panel is open now. So if you're one of those brand new nurse practitioners who are going to be flying solo from day one and you need someone to bounce XYZ off of, that's one of the services that I provide. But I just don't want anyone to get discouraged, because I'm seeing a lot of people get discouraged. And I think that if you keep pushing on, you'll get what you want. And we need you. So especially with COVID going on and what it did to the healthcare system, it's really known that nurse practitioners are very valuable. So just don't think that, don't give up. Because I'm also seeing that as well. A lot of people are like, I'm quitting. Has anyone ever quit looking for an NP job? If you can't find one, I'm quitting. Well, don't give up. You'll be good. All right. I think I touched on all the points that I wanted to touch on. If any of you have any questions, if you have any concerns, or if you just have something that you want to ask me, just send me a quick email at info.in npnowllc.com, or you can send me a message on my website at npnowllc.com. That's where I can be reached at. And I also look on my YouTube page to see if I got any comments from you guys, and I'll answer them. So I think that's all I have for today. So thank you. Happy Sunday.